We started as a lower back sensing company. It was the topic I chose to look at with when we were developing advice, because the lower backs are something that's it's got 3 dimensions of movement, which is challenging in itself, and it's obviously a very a costly condition that affects a lot of people. So we looked at lower back movement as the first kind of the first condition that we wanted to have some insights to. And if you have the sensor on the belt line and the mid part of the back, and someone bends forward, even that movement in its simplicity often adds some insight that we haven't had before. So what proportion of movement is coming from the hips versus the lumbar spine? How is the person standing even before they bend? So what's their natural lordosis? What angle is the pelvis at? What angle is the middle part of the back at? That's information we've only been able to gather from the lab before, and now you can have that in your clinic. So even something as simple as bending forward or standing, we give new insights. And then there's, when you look at the lower back information in more detail just within the clinic, you'll be able to understand how far someone can move their pelvis. So how far they can anteriorly tilt, how far they can posteriorly tilt, and where their standing position is in that range of movement. Now, to most clinicians, that information is very, very relevant. And to the patient, they don't know it, but it's relevant for where they're heading as well. So it gives that new insight. You can get a clear picture of how that person's moving in the clinic, but then you can also get a snapshot of how they move away from the clinic. The second element that I haven't talked about yet is not only do you assess, but you can share that information live with the patient. So one of the jobs as a clinician is to be able to engage with your patient, educate them, make what you tell them about the way they move intuitive, so they can grasp those concepts, and they don't only listen, but they learn, and they learn through their own movements. So every clinician who's worked with patients would have been frustrated at some stage by trying to get someone to do a particular movement. Now you often are able to show that patient their own movement live on a screen, give them a few little cues. I want you to be able to get those 2 balls on the screen to be able to align together, and that's the type of thing. You leave them to their own devices, and they wrestle and struggle to do it, but the light bulb comes on for them when they're able to do that by themselves. A little bit like, when you watch a child learn to walk, or you ride a bike, or you snow ski. Once that movement pattern is learnt by the human brain, it's a light bulb moment. And that's what you fight for as a clinician, to be able to connect with the patient in that way. So the lower back was a really good way to do the assessment part right, and then to get the life training part right, where you're interacting with that patient in real time in the clinic. And then the third element that I probably like most, but it's the most sophisticated part of the system, is interacting with the patient when they're away from the clinic. So it's saying to a patient who's got back pain, I'm going to put these sensors on you today, and I understand how you move now, and I want to be able to remind you during the day that when you sit in that slouch position, that's not good for your back. And so the device will give you a little bit of a beep or a buzz and a reminder that when you're starting to slouch, it will prompt you to move from that position. And we've put that into our clinical trial and tested that over 3 years in Australia with some quite outstanding results for the most stubborn types of back pain, so chronic back pain. So to be able to have an interaction with someone away from the clinic and multiple times a day is a pretty exciting thing, because as a clinician, you've got your 30, maybe 40 minutes with the patient, but then they often forget about you as the day goes on. But to be able to have a reminder, a little prompt, and a cue for them to change their body position during the day has been shown now in a clinical trial to give outstanding results for the long-term management of back pain, not only in the time that you do that, but a year later, still sustained results.